I'm Rue the BOOBS, and today we're talking about nipple pain. Okay, moms, let's get started. So when it comes to nipple pain, the first thing that comes to mind for me is, why doesn't anyone talk about this? I remember giving birth to my son 9 years ago, and that very first week of breastfeeding him, I remember thinking, okay, what did I miss? Am I doing something wrong? Is something wrong? Like, it was just this feeling of pure, utter confusion because I was born and raised in Zimbabwe. So watching people breastfeed was nothing strange to me. The discomforts of breastfeeding, I sat there thinking to myself, why does no one tell you about this? So I am hoping that by the end of this video, you guys are going to know what's normal, what's not, when to ask for help, when to go and get help from a lactation consultant, some of the few tips and tricks that you guys can employ on your own to kind of help you get a more comfortable breastfeeding experience, especially in those first couple of weeks when you first start breastfeeding. I also want to introduce you to some of the Haka products that can help you, especially when it comes to latching, and address some of the common concerns or common issues that result in you having nipple pain, usually related to you having a poor latch. As we talk about nipple pain, let's talk about some of the reasons why you might end up having nipple pain, or some of the things that may predispose you to have nipple pain. Now, if you follow me, you know one of the things I am so adamant about is that all new moms or expectant moms should have a prenatal lactation consult. Because a lot of anatomical findings we will know before you even have baby, right? So when I'm talking about anatomy of the nipple, what am I talking about? I'm talking about flat nipples, inverted nipples, dimpled nipples, really small nipples, really large nipples, right? So all those really short nipples, all those nipple variations can result in you having a less than optimal latch, and needless to say, nipple pain. So it's really important to kind of know ahead of time, what kind of nipple do you have? Are there some things that you can do before you even have baby? Haka has the most phenomenal nipple correctors. I actually have them here and show them to you. Okay, so these are Haka's nipple correctors. And all you're going to do is you can depress the dome, right? So you're going to depress the dome over, I'm going to do it on my arm so you guys can see it, over your flat nipple. And depending on how much you depress it, that's how much pressure you're going to get. And then you're going to let go and look at it pull. Can you see that? And that's basically what we're going to do to try and pull that nipple out while you're still pregnant. Now listen, this is a version of nipple stimulation. So it's not something that you want to do on your own. Well, you can do it on your own, but it's not something that you want to do without your provider's knowledge. So you want to get the clearance from your obstetric provider, midwife, whoever's taking care of you. And usually we're not going to have you start this until you're about 39 weeks. So we want to make sure that you're full term so that if we do stimulate those nips and you go into labor, that you're not going to have a preterm baby. So that's one of the things that I absolutely love from Haka, the nipple correctors. All right. So during a prenatal consult, that's one of the things your LC is going to look at. They're going to look at your anatomy and they're going to see, is there something that we can do? It kind of also gets you mentally prepared for some of the things you're going to need to do to kind of help your baby latch on once baby gets here, especially if you've got any of the other variations of nipples. It's not that they're abnormal, it just makes it a little bit harder for baby to latch onto when, and here is my nipple model. This is cheapo. My nipple model, my boob. And so if you're looking at this, and this is the nipple, right? So if that's your nipple right there, if you're going to have short nipples, so they're going to be in a little bit more, right? And then if you're going to have flat nipples, they're going to be all the way flat. So it makes it harder for baby to have something to latch onto. Dimpled nipples. So dimpled nipples can be short with a little bit of a dimple in the middle. And then inverted nipples, the actual nipple is pointing inward. And we can work on getting inverted nipples out. In fact, this is what correctors are really good at. And then with some moms, you can even just Haka, right? Before you breastfeed, you can put on the Haka just to help you pull that nipple out as well. Another thing that you can use if you've got flat nipples is a nipple shield. But again, if we're going to be using a nipple shield, you want to make sure that you're working with an LC. All right, so we talked about the anatomy. What happens when baby is a newborn? What causes this nipple pain? Now, let's just be real. For most of us, our breasts have never had that much friction, suction, attention, literally every hour and a half to 2 hours, 24 hours a day before. So needless to say, like everything else, there is going to be discomfort. So that's the first thing that I want you to know. Initially, in the first few days of breastfeeding, just because there's so much friction and moisture and the baby is sucking pretty hard, you are going to have a bit of discomfort. But what we expect to see is you start the first couple of days of breastfeeding, that discomfort comes up. About day 3, day 4, you're like, and then it slowly hits a peak and then it starts coming down. By the end of the first week, going into the second week, for most women, you're like, okay, this is slightly uncomfortable, but I'm kind of getting the hang of it. It's not that toe curling, oh my God, tears coming down your face pain, right? That's what we're hoping for. But if you're noticing that your pain is persisting, if you've got cracked nipples, bleeding nipples, y'all, if you've got pieces of your nipples missing, I have people come in to see me at the clinic all the time, and I call them hamburger meat. I'm like, okay, your nipples literally look like hamburger meat. And it just looks like somebody took a meat tenderizer and just went at it. And that's really what your nipples can look like when baby has a poor latch. So let's talk about that next. A shallow latch. So let's talk about where baby is supposed to latch on the breast in order to not only get an efficient but an effective latch, meaning they're actually able to pull milk out of the breast and do so efficiently. When you look at the breast, so here is my boob, here's Cheapo, and here is my nipple, right? Around the nipple, you have what we call the areola. Baby actually needs to latch onto the areola. So baby needs to be this far back onto the nipple. And if you'll notice, free the nipple. You actually want the nipple to be free and clear. What happens with a shallow latch is baby is latched onto the nipple right here. And so what baby is doing is they're actually going to compensate in how they suck, right? So sucking on the nipple is like you sucking on the straw with your tongue at the end. The milk is just not going to come out. The nipple is nothing more than just the opening, which is why when baby has a good latch, a nice deep latch is what we talk about, we free the nipple. Y'all, free the nips, right? We want to keep the nipple nice and free and clear, because what's going to happen is as baby compresses the lactiferous ducts, which are in the areola, right? As baby compresses right here in those ducts, milk squirts out of the nipple, the opening of the straw, and everybody is nice and content. But if baby has a shallow latch and baby's just latched onto the nipple, this is what they're doing. They are gumming the nipple, they're biting on the nipple, and they do what I like to call the baby shark, right? Where they're like, come, why won't this milk come out? And they're like latching on and off because they're trying to suck and they're like, I am just getting zero ROI, right? No return on my investment. I'm working really hard, but I'm not going to get anything out. So what if I work a little bit harder? What if I suck a little bit harder? So making sure that baby has got a nice deep latch is one of the first things that we want to make sure that we do so that we can prevent nipple pain. Now, if you follow me, you've seen my hamburger latch, and that's how I always instruct people on how to latch baby. The next thing you want to do is if you're getting a deep latch, you're getting all that done, but still all you're feeling is a lot of biting and a lot of gumming, then we need to check baby's oral anatomy. Now, this is something that we do once you've delivered, right? Because we need the baby to get here. And this is the thing about breastfeeding. We've got two people. We've got you and your anatomy, and then the baby's anatomy. And we need to hope that when everything comes together, things just fit really well and it goes off well. But sometimes the issues are the mom's anatomy, or you have baby's anatomy where baby has a tongue tie, right? And baby can't extend that tongue so that it goes under the nipple, under and past the nipple to allow you to actually have a comfortable latch and to prevent any nipple damage. So if you're doing everything right, if you're like, Rue, I am following the hamburger latch, I'm getting a really deep latch, but I still don't get it. I'm still getting nipple damage. I'm still in so much pain. It's been a week. It's not getting any better. In fact, I feel like it's getting worse. You're already getting cracking. You're getting bleeding. Anytime you're starting to see cracking or bleeding, y'all, you need to see lactation sooner rather than later. Do not suffer alone. Do not suffer in silence. Definitely let someone know and try and get an appointment in with an LC. All right, so the next thing that we're going to check, right, is baby to make sure that we don't have a tongue tie. Okay, so nipple trauma, just talked about that, bleeding nipples, cracked nipples, fissures in your nipples. None of that is okay. None of that is normal. You do need to make sure that you guys have an LC in your back pocket. Again, that is why I insist on getting prenatal consults, because you're going to meet your LC ahead of time. We're going to know you before you even have baby. We're going to see what your breasts look like before you have baby. If you come into my clinic, you know we take before pictures. So I want to see your breasts before you have the baby. And then after you have the baby, I'm like, oh, okay, those are rather flat, right? Your nipples may have changed a little bit. They may even get a bit bigger. So things continue to change even after you have baby. So it's really great for us to have that visual, and it's really important for you to have already struck up that relationship with your LC, and you're building that trust. So you're going back to that person, even though you all know how it is right after you have a baby. You're a hot mess. So you want to go somewhere where you can be your true, authentic self and really just tell them what is going on so you can get the help that you need. All right. So if you do have bleeding nipples, cracked nipples, an LC can, if you want to go really natural, can recommend Manuka honey. So Manuka is hospital grade honey, and you don't have to worry about the baby getting botulism toxin, right? Because it is hospital grade toxin. Hospital grade honey. So we've gone ahead and they have treated the honey to kill any traces of botulism that could be in there. So it is safe for you to put on your nipples and breastfeed. However, you will need to make sure that you wash your nipples before you breastfeed baby. This at times can be even more irritating to moms who already have really sensitive nipples, to be putting on the Manuka honey and then washing your nipples before you breastfeed. Then you're breastfeeding and you do the process again. So I found a lot of my moms complaining about it being a little bit tedious, but if you want to avoid medication, that is a great option and a great way to go. For years, Manuka honey has been used for healing third-degree wounds. So we know that it works, but again, it can be something that some moms find inconvenient. Another thing that you can get is all-purpose nipple ointment. Now that is a prescription, you get it from a compounding pharmacy. So you want somebody who can prescribe to write it for you. And it's going to have a steroid, right? That's going to help with some of the inflammation. It's going to have an antibiotic that's going to kill any infection that could be brewing or anything that could possibly lead to infection. And now think anytime you've got cracks or fissures in your skin, you have bacteria that lives normally on your skin. We don't want any of that bacteria getting into those cracks or the fissures in the nipples, because if it does, then you run the risk of ending up with a mastitis. Don't want that. Okay, so it has a steroid, it has an antibiotic, which is an antimicrobial, right? It's going to have an antifungal component to it, just in case you got yeast. Why are we worried about yeast? Because you're making milk. Milk is sweet. Your boobs are warm. You're wearing a bra. You're wearing nursing pads. So you've got a warm area with sweet milk that is in the dark. Yeast is like, hallelujah, I'm going to go ahead and colonize this area. And so sometimes we have moms who come in and they're complaining of pain, and they actually are starting to get a yeast infection. So all-purpose nipple ointment goes ahead and it addresses that. When I prescribe it, I tell my moms to use it 4 times a day for about 10 to 14 days, really no more than 14 days. I usually want to follow you and see you on day 10 so I can see where you are and how the healing process is going. I recently had a mom who came in who had a bit of she actually had a crater. Like she had a little crater where the skin was missing on a nipple. She had dimpled nipples, so baby was really struggling to get a latch on. And so we ended up going all the way to the 14 days because I had to remind her that before she put the all-purpose nipple ointment, I wanted her to invert that dimple. I needed her to pull that dimple out and get the nipple ointment into the crater so that it would heal. Again, guys, anytime you've got like visible nipple trauma, or you're just in excruciating pain, I want you guys to see a lactation consultant. All right, moving on.